Okay, then evaluating outcomes or figuring out, did it help what I did for them, or in this case, what I taught them? Was my teaching effective? So this patient's undergoing a total laryngectomy, or we're actually surgically removing the voice box, right? And so which of these statements by the client would require follow-up? And so the larynx, remember, is here. It's the voice box, so it is in the throat. It is a throat surgery. And they're going to go in and actually remove the voice box. And so which of these statements would require follow-up? And what that means is which of these has the patient said incorrectly, and we need to either revise teaching or get the healthcare provider to come provide them some more education about, or what. So I will have to practice using a mirror to care for my stoma. Well, yes, that is important. We really want these patients to care for their own stoma before they leave the hospital. This can be a very emotional surgery. They might lose their voice. I mean, they will, right? And they're going to change their body image. And so it's important that they maybe use a mirror, and we kind of coach them through getting comfortable practicing caring for the stoma, just like you guys are getting comfortable answering tricky NCLEX questions. So this is correct. It does not require follow-up. Then when I'm discharged from the hospital, I won't need the feeding tube. Yeah, we're not going to be, taking out their tongue. They shouldn't have any issue with swallowing. This is just their voice box. We're omitting totally different pathway. The air travels in and out of your lungs to generate your voice, not your stomach, your esophagus. So they should be able to chew and swallow just fine. My husband's bought me some scarves to wear over the stoma. And this is also fine, right? As long as it's not like dirty or too tight, then there's no issue with that, and that can be really helpful in helping them adjust to their new body image. Same thing after like a thyroidectomy. And then I see that Marky says larynx is a voice box, it will not return to normal. And yes, that is correct. If the patient says, after this surgery, my voice is hoarse but returned to normal, we want to make sure they understand before they go into this surgery that no, we will be taking their voice box out. They will not have a normal voice. And what this is showing here is a voice prosthesis, where basically you can redirect the airflow temporarily and create this kind of digitized sounding voice from the airflow. And so this is part of informed consent, right? That the patient would understand the risks and benefits of the surgery. In this case, that the outcome would be they would basically be cured, hopefully, of whatever laryngeal cancer, but they won't have a normal voice. So this would require follow-up. And you guys are right.